Hi, this is Jon+Thompson, Vice President of Marketing at Contact Media. I want to welcome you to the first video in our series on marketing for medical practices. Let's jump right in. There are two primary mistakes that medical practices make with their marketing. To begin, let's look at this picture. Obviously, it's a picture of a pyramid. The very top of the pyramid represents a small group of people who are ready to set an appointment now with a medical professional. Perhaps they've either received a referral or they've done their own research. Either way, they are now interested in taking that next step of setting an appointment. The bottom of the pyramid represents all of the people that don't have any current needs with your practice and never will. This percentage varies depending upon the type of practice. This middle area, which represents a much larger number of people than those at the top or bottom, are those who are not quite ready to set an appointment today, but do have some level of interest. We like to say that this group is somewhere along the sales funnel. They're being proactive, looking for solutions, they're asking friends, researching online. Eventually, these prospects are going to make an appointment with someone. But mistake number one is that most all medical practices market to the same small number of prospects who reside at the top of the pyramid, yet very few address the larger group of prospects who might be a few weeks or so away from being ready to set an appointment. The second biggest mistake is that most marketing doesn't stand out. It doesn't differentiate from the competition. The ads waste time or space promoting things that are equally true of your competition. Maybe they list the services they provide with a picture of the doctor or doctors. They tell you they provide exceptional care that they've been providing for X number of years. They're conveniently located and offer free consultations. You can interchange the name of the practice and change the picture of the doctor, and your competition could use the same ad. Sound familiar? Now, there are some practices who offer seminars, which I'll talk about in a few minutes. Some practices promote pricing specials or coupons. That seems to be especially common with dentists. Other than the price, there seems to be little reason to choose one over another. Again, no differentiation. Those with the largest budgets win. So, what's the answer? The key is first to develop marketing that addresses both the top of the pyramid as well as the middle of the pyramid. Sure, it's fine to include free consultations with a phone number and what all you offer, but that can't be the main focus of your advertisement. You need to focus on the far larger number of prospects. Remember, this group is seeking information to become better educated, better informed before making a decision. Ever since the internet, prospects are far more educated than they used to be before calling for an appointment. More and more prospects do not want to set up an appointment until they feel comfortable with the research and believe you are the expert that will provide solutions for their specific situation. You need to be the one providing this information. You have to take them on the journey from being uninformed to them choosing to use your practice because you are the expert. How do you establish yourself as an expert? Think about a college professor. How does a college professor attain prominence? They do research and publish their findings. They create content for people that's helpful. They write books. They create CDs, DVDs. They write articles and white papers. They do seminars and webinars. These are all ways to provide helpful content to people looking for answers, ways to position your practice as the expert. As you know, you can't communicate a lot of information in your ads. Essentially, ads are sound bites. You're trying to put an attention-getting headline out there, get people interested, and get them to essentially raise their hand and say, yes, I'd like to find out more. Please give me some more information. You're providing what we call a low threshold offer. The prospect isn't signing up to be sold. They don't have to set an appointment yet, but they are asking for more information. This marketing approach will appeal to a much broader group of prospects. It differentiates you from your competition and it positions your practice as the expert. Let's look at some examples and see how common these mistakes I've mentioned are. Here's a recent direct mail piece that I received. The headline isn't bad. If I've been inactive recently and have had bad knees, I'd probably be intrigued to open up the piece. But then what valuable information do they tell me on the inside? I have options. They have teams of orthopedic specialists to diagnose and treat my knee pain with high quality care that you know and trust. Any other competitor could say the exact same things. Let's see, it also says they have a respected team and the quality of care in my patient experience is their top priority. They're dedicated to better overall outcomes in patient care and demonstrate a commitment to quality and safety. Does any of this really differentiate them? Here's another example. The headline is Quality Care at Every Stage of Life, immediately followed by the claim of here to serve with the highest quality care since 1987. They list their services and tell me they're accepting new patients. Does that differentiate? It sounds the same as every other ad. Here's another example. This is a local ophthalmologist group whose headline in their ad is, "We're clear on our mission to bring clarity to all that you see." Is that going to influence a prospect? Then they go on to say that they specialize in cataract surgery with premium implant lenses including Technis, Restore, Toric, and that their care includes the SLT laser treatment. I wonder how many people actually understand the benefits of any of that because the ad doesn't tell you. The ad has a picture of the ophthalmologist and includes a phone number and address. No mention of a free consultation in this one or even a web address. What this ad is missing is a strong headline, like maybe how this group is using the most revolutionary procedures that provide less scarring and less discomfort than ever before. Call such and such number or go to such and such a website for a free video that will demonstrate how this procedure works and how you'll have improved vision in no time. Or offer a book or a report on what to look for if you have specific symptoms, along with a guide of how to know what procedure is right for you. Here's an example from a local vascular surgeon. It's one of those two-sided direct mail pieces. The headliner's okay. On the back, they use 6 bullet points and 13 lines telling why this doctor is great. They show a picture of before and after, which is effective, but basically they skip both any mention of an initial consultation offer or any offer to provide expert informational content, and they go right to providing discounts for actual treatments. In his 3rd bullet point, he even mentions that he's an author, but doesn't provide any offers to read some of what he's published. Remember, prospective patients are trying to learn more about their current situation and to find the right doctor. This would have been a great opportunity to advertise this doctor's content and how it would help the consumer. Invite this prospect to take action via your website to learn more because you are the expert. If he had promoted some of his informational content that he's the author of, he would have positioned himself as an expert and wouldn't need those 6 bullet points. Here's one last example. I'll give them credit for an attention-getting headline. The ad is pink, which is good since it's targeting women, and the approach, hosting a seminar, is very common in the medical world. The good news about promoting a seminar is that it's very measurable. The ad does attempt to take a little time to explain why you might benefit from coming to this seminar, but I'm not sure it's crystal clear. In fact, it wasn't clear even to my wife, and she's a nurse. And while this doctor probably is an expert, she is hosting a seminar, is there anything that makes her different from other gynecologists that you can mention in the ad? But here's the biggest missing piece. I believe there's a fair chance that there are going to be many women who don't feel comfortable going to a hotel surrounded by strangers to address the personal nature of this seminar. In fact, there are many prospects out there that don't like attending seminars, period. And sometimes the prospects already have plans for that day. Now, I don't know what the exact percentage is, but let's say 30% of potential consumers either can't make it or don't find this an ideal setting. And I would bet that percentage is low. I would offer a plan B where people can submit their contact information and they'll be emailed a video of the actual seminar. This approach is less threatening and offers you even more opportunity for new patients. There's no reason to waste any of your marketing dollars, and ignoring that 30% or so is wasteful. Regardless of what your medical practice is, there are many prospects out there eager to learn more, looking for expert advice before setting an appointment. It's imperative that you have strong content that may be delivered to these prospects. So in summary, the two biggest marketing mistakes are: number one, not focusing on the larger number of prospects, but just focusing on the top of the pyramid, those ready to make an appointment right now. And the second biggest mistake is failure to differentiate. Do not let your ad sound and look like everybody else's. In the next video, I'm going to tell you how to capture leads from your expert content. It's not enough just to create great content and give it away for free without ever hearing from your prospects again. I'll walk you through a systemized process that'll convert your prospects into customers.